Freddy's a unique individual, as you know. He lost the upper part of his arm back when he was very young, and he's lived a very functional, productive life with just one arm. I first met Freddy back in, I believe, 2002 when he came in with shoulder pain, and the x-rays showed some fairly severe and advanced osteoarthritis of the glenohumeral joint, basically wear and tear arthritis. And you can imagine when a person just has one arm, the other arm gets twice as much activity. Plus, he's a hard-working man as well, and a vigorous and avid golfer. So he's put his shoulder through a lot. And you're exactly right. Operating and doing a complex reconstruction on someone with just one arm is a little bit stressful on the patient and concerning from a rehabilitation standpoint as well, because they don't have the other arm to do for themselves right after surgery. So we were a little bit concerned about that, and certainly the stakes are high if things go wrong, that now they don't have any arm with which to conduct their life. But he was a bit backed in the corner with his bad arthritis, couldn't play the golf the way he'd like, couldn't work and use his arm the way he'd like. And so he and I agreed that the best course was to proceed with the total shoulder replacement. The good news about that operation is many times people wake up after surgery with less pain than they went to sleep with. It sounds like a big scary thing, a big open cut on the arm, sawing off pieces of bone, putting in metal and plastic. It sounds frightening and scary, but if you've got the right diagnosis and a bad enough problem, it's an amazing transformation, because you, even despite the surgery incision and the surgery pain, you often wake up with less pain than you went to sleep with. And it's the kind of thing where even though you've had the operation, you can still move and do a little bit for yourself right after surgery. You can make yourself a sandwich, feed yourself right after surgery. You can read a book, use the TV clicker. I wouldn't want you right after surgery to break rocks with a sledgehammer, chop down a tree, or wrestle a bear. But you can do light things right away. And so I think with realistic conversation with Mr. Clontz and letting him know what he could and couldn't do after, of course covering the risks involved, and with the realistic expectations, he and I both agreed, despite the magnitude of the surgery and the risk of the surgery, that was going to be the best option for him. He's basically a can-do guy with one arm who's really never used that as an excuse to hold himself back, and so that's always impressed me about Mr. Clontz. The other thing certainly is that he is a scratch golfer as a one-arm guy, so that certainly stands out in my mind as well. And we do operate on people with a single limb, but that also is unusual. So I mean, all those constellation of factors, the stakes are high when you've got only one shoulder and you're doing a complex reconstruction on it to make sure that you get a good result. So let's say the stakes were higher than typical, and all those factors stood out in my mind. The other thing that's great about the story is that he's had a wonderful result. And not that that's unique or different, because you can expect great things from that type of operation if done properly and for the right diagnosis and in the right setting. But thank God he did have a wonderful result, because I've always been impressed by how well he's done after surgery. He's a remarkable guy. He's had at least one that I know of hole-in-ones since the operation, and he's always competed well even after the total shoulder replacement, which is of course more than you can ever guarantee a patient, but happy to know that he had that great result.